On May 27th, the U.S. Department of Health and Human Services Secretary Kennedy announced a new COVID vaccine policy, saying that the CDC was dropping its guidance that the COVID vaccine be offered to children ages 6 months and older, and dropping the guidance that the COVID vaccine be offered to pregnant women. The announcement came in what Kennedy called a Secretarial Directive, outlining the change, and he signed that directive on May 19th. The announcement changes years of policy aimed at protecting Americans from the coronavirus. It also disrupts the standard process for vaccine recommendations. Typically, a recommendation is made by the advisors to the CDC based on studies, data, side effects, and research, etc. The secretary is not directly involved in those matters. And in fact, the CDC advisors were set to vote on the vaccine recommendations in June. Kennedy's announcement leapfrogs that protocol. And in fact, the CDC nor its advisors were consulted in his decision to make the directive. The policy changes eligibility for the fall COVID vaccine. The policy says it should only be administered to people over age 65 and those with certain medical conditions. And we already have a conflict because on the CDC's list of listed medical conditions, it does include pregnancy. And states have the authority of whether or not they're going to mandate certain shots for children, such as to go to school or daycare. So it's not clear what this new policy would do, if it would prevent states from continuing to recommend COVID shots for children. Also unclear, insurance coverage for the vaccine for children or for pregnant women. It's looking likely that Medicaid and Medicare would not cover the vaccine. Experts say that if other insurance carriers do, pregnant women may have difficulty finding a pharmacist that would be willing to administer it if it's not on the recommended list of vaccines. And others are worried about cost. If a person has to pay out of pocket, they say it gets expensive, and they give an example. For young children, CVS charges $198.99 per dose, and most children need 2 to 3 doses in their primary series. You can read that Secretarial Directive. We link to it in the description below.